Well, Novant Health is using cutting-edge technology, and they announced it's taking 2 new major steps in diagnosing and treating lung cancer. So by the end of the year, the hospital will be adding robots to do minimally invasive biopsies.
It will also be using a new artificial intelligence platform and catching cancer quicker. Queen City News reporter Daniel Pierce joins us in the studio tonight.
And Daniel, so put this into perspective in terms of the impact this will have on people waiting for answers.
Well, we're several months out from this type of AI technology being implemented within Novant Health. However, similar artificial technology is being used across the country, cutting down wait times by days to weeks for doctors and patients. Hospitals across the country finding new tools in their digital arsenal
to try and improve the delivery of healthcare.
Novant Health announcing that it plans to use artificial intelligence in radiology departments to comb through patient reports to catch potential problems.
Needs to deliver care more timely, with greater depth of information.
Dr. Nathan Cross at the University of Washington doesn't have insight into what Novant Health will specifically use. However, he says hospitals typically rely on algorithms to study a patient's x-rays in real time, going pixel by pixel, alerting radiologists on findings before they've even had a chance to look.
Using AI tools to look at large amounts of x-rays. You can set it up to catch every possible case of a specific entity, knowing that when you do that, you're also going to include some false positives. Or you can set it up to be have a very high positive predictive value, knowing that you're going to miss some.
This is a mess right here, haziness.
AI use in hospitals isn't new, but medical centers across the country have started to turn to it to accommodate for staff shortages. The CDC reports 70% of the shortages are at facilities in rural America.
May not have a dedicated neuroradiologist, but have a general radiologist who's very good, but maybe tied up with some other cases. This could elevate a case to the top of their list, bring it to their attention.
Again, Novant Health wouldn't go into detail about what their artificial intelligence program is going to look like. But we did learn that there are also racial biases in artificial intelligence. Algorithms rely on radiology reports, and urban facilities will have a different spread than rural facilities. Dr. Cross stressed that there are discussions on how to fix that, but the tech is a major step in cutting delays in care. Alicia.